Welcome to the GI Nutrition Show. I'm Amy McCrea, registered dietitian and CEO of Grounded Root Nutrition. Today's topic is what is integrative and functional nutrition? So, integrative and functional nutrition is a holistic, whole body approach to healing that seeks to uncover the root cause of symptoms. It allows a very personalized plan that targets the true issues and brings resolution. And to reach ideal nutrition status, we need to optimize all systems of the body. Why? Because they're all interconnected. And each system ultimately links to digestion, which inherently influences nutrition. And as a GI specialist, you can probably understand why I find it very important to explore all systems of the body. So this is why when you see a functional nutrition provider such as myself, we're going to ask you 1,000 questions. We dive deep, assessing both past and present circumstances, each giving us clues into the origins of your symptoms. So let's take a deep dive into what these 1,000 questions might be and some of the topics we would cover to really understand what is happening inside your body. So we'll take a deep dive into the environment. I want to understand your living conditions and potential exposure to mold, whether it be in the past or in the present. Allergens, toxins, and pests like ticks or even bed bugs. These are all so important. We'll also explore your lifestyle. Movement is one of my hot topics, and I don't want to just think of movement in terms of traditional exercise. I want to think a little more broad. And what kind of movement are you getting throughout the day? How do you move your body? What do you like to do? Do your weekdays vary from your weekends? And if so, what do they look like? I want to understand it. Not because I'm trying to assess right versus wrong, because I'm really just trying to understand where you are today. Then we'll look at electronics. Everything from bedtime routines with electronics, how you sleep, to what you're doing during the day, what your posture might be like, all super important. We'll look at sleep, including that bedtime routine, how many hours you think you're sleeping versus how much you aim to sleep every night, and what does that quality look like? This is so important. Sleep is very restorative, and our body depends on it. I want to know socially, who do you live with? Maybe what area of town you live in, if that's something that you think is very relevant. And who do you eat with? All, again, incredibly important. So speaking of eating, we'll also dive into your eating habits. I want to understand what your preferred foods are and any cravings you might have. Talk to me about your eating routine, whether that be eating out, cooking yourself, convenience foods. Doesn't matter to me what you're doing at this point. I just want to get a better understanding of you and what our starting point is from. I'll either do a 24-hour diet recall or I'll have you complete a 3-day food journal. It sort of depends on your situation and which I think might work best for you. I'll ask you questions about your birth. I want to understand if you were born vaginally versus cesarean, as well as breastfed versus bottle fed. These do indeed affect our microbiome, and I want to understand where our starting point was for you. Next, I want to know all about your health history. So what are these symptoms that brought you to me today, as well as what are some of those symptoms that have continued to elude doctors perhaps for years? I want to understand those, and I want you to share them with me. I want to know your medical diagnoses, whether it's formal or informal, any tests you might have had done and those results, as well as family history. So if you know your family history, whether it's siblings, parents, aunts and uncles, grandparents, even your own kids, I want that information. It's very helpful to us to allow the opportunity to connect some dots and understand where you came from and how you might have gotten here today. We'll also take a little bit of time to explore emotional health. Now, I am not a licensed psychologist or psychiatrist for that matter, and so I don't need to know all of the details about past trauma, but I am going to ask you about it on a very high level. So just give me a category for what that trauma was, and then I want to know if you've had any past or present counseling and sort of where you feel you are in the recovery process. That affects you. Our mental health definitely affects our body's ability to communicate with our gut, that kind of gut-brain axis. And so we really want to understand anything that might be getting in the way. And so I'm going to explore those questions. I want to know about stress. What are your current stressors and what do you do to manage it? And then your mouth, all about your teeth. How often do you get them cleaned? Do you have any fillings or crowns? And if so, what color are they? And maybe even implants. All very important information. And then medications and supplements. We can't forget this. So when I ask you about your prescriptions and your supplements, I need you to be able to tell me the name, possibly the brand if it's a supplement, dose, frequency, and why. The why is so important. First, you should know why you're on any type of medication or taking any type of supplement. And I really need to know what that why is, because sometimes we actually use things that we call off-label. So I can look at my drug guides, and the reason why I see you need a medication might be totally different from what is actually being used. So it's really important for me to know the why, but more importantly, for you to know that why. So be sure you ask if you don't know. So this is just a snapshot about all of the things that we go into when it comes to integrative and functional nutrition. Answering these questions helps us formulate what possible pathways and roadmaps we might need to follow to understand how your symptoms even came to be. And when it comes to gut health, there are so many reasons. So from here, we typically will then do functional lab testing. There's so many different tests out there that offer a lot of valuable insight. The most common ones that I use include nutrigenomics, which is very specific genes that we can influence through diet, lifestyle, and environment. It's one of my favorites. It helps me understand the cards you were dealt and what nutrition things we need to do. What do we need to plug in to help you feel better? Stool testing, breath testing or SIBO testing, food sensitivity testing, hormone testing. We can look at organic acids, micronutrients, mold, or even tick-borne illness testing. So those are the most common ones I use in my practice. There are a lot more, but that just is a dabbling for you. And together we'll use this information to create a personalized plan for healing for you. We want to optimize cellular function. We want to learn to choose whole foods that are going to nourish your body. So what are those foods that your body needs? And even explore what we call gene whisperers. So these are specific foods or even flavor enhancers that truly do talk to your genes and give you the best results. We'll learn to create an environment that supports healing, and we'll also utilize supplements as needed for both healing and restoration. Now, some patients ask me, what about traditional or conventional medicine? And there is a time and a space for traditional, conventional, and functional medicine, as well as other alternative therapies. And many of my patients use a combination of both. I encourage patients to allow me to work collaboratively with their current medical teams, bringing both of our healing philosophies together. Teamwork truly does make the dream work and allows patients to heal so incredibly well. Through teamwork, there's also the potential that some of the testing that we want to do, specifically nutrient testing, would be covered by insurance. So that brings up my last point. Why do I, like many functional nutrition providers, not accept insurance? And the reason is because my goal is to provide you with the highest level of service possible. I don't want to be restricted on the materials we cover, the time we have together, or even the approach that we use to bring symptom resolution. Eliminating insurance offers complete flexibility and allows us to fully focus on you, and you are my priority. I hope you enjoyed today's show. Please visit my website, groundedrootnutrition.com, to learn more about how I can become a partner in your health journey, or contact me directly at hello@groundedrootnutrition.com. Have a wonderful day, and I'll see you again soon.